Hello, I'm Beverly Kirk, Director of the CSIS Ideas Lab, here with Stephen Cornish. He's with Médecins Sans Frontières, also known here as Doctors Without Borders, and we're talking about the targeted medical violence that's going on in Syria. You were recently there. Can you please tell us what you saw?
Yes, I'd love to, Beverly. What we did see was really the complete collapse of the Syrian healthcare system, and that was initiated as you began with direct attacks on medical personnel and medical facilities. But then that spread. I think the fear that it created led to a brain drain and led to doctors and nurses fleeing the country, but also led to an appropriation of medical structures by both sides on the conflict, whether out of strategic necessity or by tactical design. It's not really clear. But that has brought further risk to those providing care on the ground.
And how has it impacted care for the people who are impacted by the violence?
Well, it did two things. I think at the beginning, there really was a lack of surgical facilities available. That has since rebounded, but a lot of those surgical facilities have had to go underground, which makes it sometimes difficult to find them, but also limits the amount of patients that they can take care of, limits the different materials that they have on site. The second real large the second real large problem here is that it's almost stopped the access for civilians. There's a whole series of silent casualties to this war. Anyone who had a chronic disease can no longer find treatment. Children haven't been vaccinated since the beginning of the conflict. So there's a real health deficit that's starting to see itself in the public health sphere as well.
How are NGOs and other medical personnel responding?
Well, one of the things we've done is to send medical supplies across the border and to train up the remaining health personnel in the country to be able to deal with the situation. In the northern areas, in the opposition areas, we've been able to cross into the country and open up additional surgical facilities, as well as to support and train doctors in dozens of other structures.
Talk about MSF's role in aiding this medical response.
Well, we've worked with all the organizations that have managed. Unfortunately, there's very few organizations that are inside Syria proper. And so we'll partner with whichever organizations are able to get there. I think a lot more needs to be done to encourage the surrounding countries to allow more organizations and more relief supplies to flood inside Syria, not only to start taking care of refugees once they're able to flee.
All right. Stephen Cornish from Médecins Sans Frontières, Doctors Without Borders, thanks for being here.
Thank you, Beverly.